So good afternoon, everybody, and welcome to today's webinar. I'm Donna Rice, the Chief Operating Officer for Diabetes Sisters. At Diabetes Sisters, we believe in the power of connection and its positive impact on our health and well-being. Today's webinar on eye health is titled Protecting Your Vision Through a Healthy Lifestyle and Colorful Eating Plan. We want to thank our sponsor, Regeneron, for bringing this webinar to life. We're very excited about it. The CDC actually reports that 90% of diabetes-related vision loss is preventable. And key strategies include the annual eye exam, a balanced lifestyle, and of course, incorporating plant-based, colorful foods into your diet. So let's continue the conversation on eye health. Our speaker today is Janice McLeod. Janice is a diabetes cardiometabolic consultant and thought leader in digital health and chronic condition management. Janice has led clinical advocacy at Medtronic and Companion Medical and has served in clinical leadership roles with WellDoc and Johnson & Johnson. She is the past chair of the Academy of Nutrition and Dietetics, the Diabetes Practice Group, and has been elected to the Association of Diabetes Care and Education Specialists Board of Directors. Janice has authored multiple publications and developed numerous programs on diabetes, nutrition, digital health, and practice transformation. So please help me welcome Janice McLeod.
All right. Well, thank you so much, Donna. And I want to thank each of you, Diabetes Sisters who are attending today, taking the time to learn about this very, very important topic. And that includes, as Donna just said, adopting a colorful approach to eating. So that's going to be our main focus today. We know that over a third of people with diabetes have diabetes-related eye disease, and those numbers are growing all the time because here in the United States and across the globe, the number of people with diabetes is growing all of the time. But there is some good news, and Donna just stated it, 90% of vision loss due to diabetes can be prevented. And so that means there's steps that we can take. And I wanted to just start out before we jump into the colorful eating patterns to talk about those top 5 things that we can do proactively to prevent eye disease and vision loss related to diabetes. So Donna mentioned the dilated eye exam. That's annually. Number 2 is being alert for and aware of and watching for any vision changes and reporting those to your eye care professional. And then number 3, and I have it bold and in color because this is where we're going to focus today, is developing the healthy lifestyle. And then number 4 is all about managing diabetes as best we can. And then number 5, not smoking. So let's talk about each one just briefly, a minute more. First of all, about that annual eye exam, the American Diabetes Association recommends that when a person is diagnosed with type 2 diabetes, they should go ahead and get an eye exam right away. And the reason for that is because there can be a delay in diagnosing type 2 diabetes. 1 in 5 people, when they're diagnosed, already have eye disease. Now, with type 1 diabetes, since we're not as likely to miss that diagnosis, the ADA recommends that within the next 5 years, you get an eye exam, and then thereafter once a year. So why is it so important to keep getting these eye exams? It's because it allows us to identify any changes in the vision, any damage to the eyes very early on when the treatments that are available can be most effective. And so that's why it's absolutely important to do this. But here's the not so good news. Less than half of people with diabetes actually get that annual eye exam. So why would that be? Well, you know, it is inconvenient. It takes time and effort, and the dilation that's required makes your eyes super light sensitive. And so people, tend to feel like that's an inconvenience because you need a ride to and from the appointment. It makes the rest of your day unproductive. Um, and then too, I think part of it is that people are a little bit afraid of what they might learn on an eye exam. And so they're afraid of bad news, and it's just easier to postpone it. As women, I think as a rule, we tend to be more proactive with our health. And I think this is just an example of a place where we need to set an example by getting the annual eye exam ourselves, but then also urging our family members, our friends, our neighbors, people in our community that we know with diabetes to make sure they're getting this annual eye exam. The other thing I want to share is that there is some good news happening here. People recognize that the annual eye exam is very burdensome, and with the growing number of people with diabetes, we have to do something to make it easier to get to more and more people so we can prevent eye disease and vision loss. So, new technologies are being developed that may just require a picture of the back of your eye without the dilation, at least as an initial screening. And also, there's artificial intelligence tools being developed and a couple already approved. So stay tuned. I think the news on making it easier to get this annual eye exam is going to be very bright coming up. So hopefully it will be not so hard. But meanwhile, I would just challenge each of you on the call to think about, now, when did I last have my eye exam? And if it's been within 11 months or more, it's time to get that next eye exam scheduled, or maybe for you, it's the first one. Just get it done because this is how we can really detect and prevent eye disease and vision loss. Now, what about some of those vision changes that we want to be watching for? What do I mean by that? Things like floaters in front of your vision, dark, empty areas in your vision, less vivid colors can be a problem, blurry vision, but I do want to differentiate. There is a temporary blurry vision that can happen when blood glucoses are changing rapidly and the lenses swell. That is temporary, that's going to go away. The kind of vision disease, eye disease, and vision loss that we're talking about today is actual damage to the tiny blood vessels that nourish the back of your eye, the retina. They become damaged. And that's what we're trying to prevent with these eye exams and so forth. That can lead to more permanent vision loss. So you want to be making sure you have access to an eye care professional. The ADA says it can be either an ophthalmologist, which is a medical doctor that specializes in eye disease, and then, or it can be an optometrist, which is a doctor of optometry. They are more limited in their scope of practice, but both can do that initial eye exam. And there are websites that we've provided in the newsletter series that just was released that will give you links to the websites where you can find an ophthalmologist or an optometrist in your area. And the other thing, these websites of both of these organizations are incredibly helpful and full of a lot of great educational materials that I think you would really appreciate. So I invite you to get to those websites, find an ophthalmologist or an optometrist, and learn a bit more. These pictures illustrate what some of those vision changes would look like. So in the first picture, which comes from the National Eye Institute, from the National Institutes of Health, you're seeing those adorable little boys with their colorful balls. And we're looking at it from the perspective of somebody with healthy vision, which is great. The next picture over at the top has those black spots in the vision. This is what that same picture can look like if somebody has diabetes-related retinopathy. So you can see why it's so important that we prevent this. The next picture, first one in the bottom, shows you how that same picture would look to somebody with glaucoma. So they're losing their side vision, they're losing their peripheral vision, it's kind of closing in. And then the last picture there at the bottom is showing you sort of that cloudy vision that you might see with cataracts. All right, and then Next, let's move on to talking a little bit about developing a healthy lifestyle, and we'll be coming back to this one. The same healthy eating plan that is good for diabetes and that's also protective of your heart are the same eating plan that's going to be good to protect your vision. So that's really the good news. It's just solid, good, healthy eating that we're going to be talking about in a minute. But also really important is being physically active. That's key to a healthy lifestyle. And all of the major organizations are recommending around 30 minutes or so, 5 days a week of aerobic type activity like walking, cycling, swimming. It is a good idea, though, to talk about your exercise routine and any changes you're making with your doctor, especially if you already have any diabetes related retinopathy. And then also really important is managing stress. We can't prevent it, but we can manage it, and also developing good sleeping habits, building coping and problem solving skills. I wish we had time to talk through all of those. We don't, but we will come back and focus more on the healthy eating in just a minute. Now, the fourth strategy is diabetes management for helping to prevent vision loss. And so we talk about the ABCs of diabetes, A standing for A1C, a longer term picture of your glucose management. B is for blood pressure, so important to keep that managed. And also then C is standing for the blood cholesterol levels or lipid levels. And your doctor very likely prescribes different medications to help in managing A1C, blood pressure, and cholesterol. Really important to take those medications as prescribed, but also really important is being actively involved in self-managing your diabetes. And so I've added a fourth alphabet letter there, D, for diabetes self-management education. Really want to encourage you to learn everything you can about diabetes so you can be involved in self-managing your condition. And the ADA, along with a bunch of other professional organizations, recommend these 4 critical times to see a diabetes care and education specialist. That's somebody that specializes in diabetes, who's a dietitian, a nurse, pharmacist, other professional that can help you learn about diabetes. And the 4 times that are recommended is, of course, when you're first diagnosed. There's so much to learn about. But thereafter, it's recommended that every year you do a little tune-up with diabetes education. So many new things and new medications and therapies and so forth. So it's good to get an update. And then when complicating factors develop, so let's say you develop any eye disease or other problems, it's good to see a diabetes care and education specialist that can help you make those adjustments. And then when transitions in life and care occur, an example there could be you start a different kind of medication or insulin therapy, or you start a new technology. Maybe you're interested in starting continuous glucose monitoring. That's another good time. And there's a link there for helping you find somebody in your local area who has this certification as a diabetes care and education specialist. Donna and I are both, by training, we are in this profession. Donna as a nurse and I as a dietitian. All right, and then the fifth, of course, is no smoking. And, so that means if you smoke, it really is important to come up with a plan for quitting. Easier said than done. The CDC has some great resources for helping with quitting that I've got up here on the screen, and their website there at the bottom. And I would encourage you to also talk with your doctor about any local resources and stop smoking programs that might be available for you to help. All right, so now we want to turn to this topic of what to eat. And this is always the burning question I find that people with diabetes have is, what can I eat? And so we'll answer that by asking another question, which is, which eating pattern is best? You've probably heard of different eating patterns or dietary approaches that are recommended. I've listed a number of them here, including the Mediterranean eating pattern, which is so named because it's based on what people that live around the Mediterranean Sea eat, or at least loosely. In years past, we've heard a lot about low-fat eating patterns, and in more recent years, low-carbohydrate eating patterns, and then even vegan or vegetarian eating patterns where we eliminate different animal products. And the DASH eating pattern is a pattern designed to help lower blood pressure. But how do we know which of these eating patterns is best? Well, the ADA in their nutrition report that they publish every few years answers that by saying it depends. It depends on what are your goals. And so they have a table, something like this one, where all the different eating patterns are listed here on the left-hand side. And then across the top, you see different goals that somebody might have. Like if you've been told you're at risk for diabetes, your goal might be, I want to prevent diabetes. Or maybe you and your doctor are trying to lower your A1C or reduce weight or blood pressure, whatever it might be. If you see a little check next to the eating pattern, that means there's a lot of scientific evidence that shows that that particular eating pattern is particularly good at helping with meeting a particular goal. So you'll have access to these slides and can be able to look at this in more detail later on. Now, the ADA also in their nutrition report stresses that there are 3 really important nutrition principles that are in common among all these different patterns. And the first one is to emphasize the colorful, low-calorie vegetables. So thinking of incorporating a lot of plant-based foods in our meals, minimize added sugars and refined grains. So sugar-sweetened beverages, white breads and flours, and that kind of thing are what we want to try to cut back on. And instead, the third nutrition principle is choosing whole foods over highly processed foods. So plant-based whole foods. That doesn't mean every food you eat has to be in that category, but we just want to have that emphasis and focus in our choices. So I want to talk today a little bit as we talk about vision health, the Mediterranean eating pattern, which is often recommended for vision health. And so you can see the beautiful foods that are part of a Mediterranean eating pattern, and then all the recommendations about a Mediterranean eating pattern are listed down below. And we're going to talk about each one of these in the next few minutes here. So let's start with the colorful fruits and vegetables. I absolutely love this vegetable and fruit artist palette. It is almost what it looks like here, just all of the different colors. And so you really do want to think about color when you're thinking about filling up your plate. Vitamin A is considered sort of the eye vitamin for good reason. It really does protect your eyes. It's an antioxidant. And we happen to get vitamin A, especially from orange foods. So carrots, sweet potatoes, cantaloupe, apricots, and so forth are really rich sources of vitamin A. Now, vitamin C is another antioxidant that helps protect your eyes. And we get that from citrus, of course, from strawberries and tomatoes, from peppers and broccoli and dark green leafy vegetables. So think about how we've really incorporated so many of these colors already here. Now, why are these antioxidants and these colors so important to our eye health? It's because the eye is susceptible to oxidative stress, and that just means it's really sensitive to damage from what are called free radicals, just damaging substances that are in the environment, and our body even manufactures some. I think of free radicals in a very kind of simple way, just to picture it in my mind is they're like flaming arrows, and they're aiming at our body to try to damage it, and our eyes included. And when you eat those colorful fruits and vegetables, it's as if you're putting up a little shield that's protecting your eye from those damaging flaming arrows, those free radicals. And our eyes, because they're very oxygen rich and exposed to all that light, are very, very susceptible. So every time you're eating a color, you're putting up an antioxidant shield, you're helping to protect your eyes. But people tell me, and I myself struggle to try to get enough colorful fruits and vegetables into my day. So I put this little slide together to give you ideas, starting with the very first meal of the day, how you can get some vegetables and fruits in, even before you had your first, even by your first meal of the day. So one of my favorites is carrot muffins, and I'm going to share the recipe for that in our recipe collection that we're making available to all of you. Adding chopped vegetables to even your scrambled eggs or omelet in the morning. Even at snack time, we can begin working in fruits and vegetables. I love this hummus vegetable and fruit snack board or tray that's pictured here. My colleague, DJ Blattner, who's a registered dietitian, actually gave me permission to share this with this Diabetes Sisters group. She was thrilled to share it with you all. And her website's at the bottom where you can get a lot of other ideas for snack boards, grain bowls, and those sorts of things that are really a fun way to get lots of extra fruits and vegetables. I did this snack board actually for a lunch one day and just had a lot of fun with it. Also at lunch, some things that I like to do to help get in more vegetables. If I need a quick meal and I open a can of soup, I'll extend it by adding extra mixed vegetables from the freezer to help reduce the sodium of that soup. It extends it and gives me extra vegetables. And then at dinner, I like to add extra vegetables to sheet pan dinners. Roasted vegetables to me have such a great taste, and it kind of encourages me to maybe eat a little bit more. Sweet potatoes cut into strips and baked for fries, substituting mushrooms for steaks and burgers, another fun way and really tasty to get more vegetables in. Now, you also, we want to support our eyes with a very important antioxidant nutrient called vitamin E. And vitamin E is another antioxidant, and we get that from a variety of different nuts. One of the richest sources of vitamin E are almonds. Now, almonds are a nutrition powerhouse. So think about adding nuts to salads, steamed vegetables, stir fry, cereals, yogurt, trail mixes, granolas, muffins, and so forth. And you can spread nut butters on whole wheat breads and crackers, but also fruits like apple slices and carrot and celery sticks are great vehicles for nut butters. And then some other ideas are listed there too. Now, omega-3 fatty acids are particularly helpful and healthy for protecting your heart, but they're also super good for your eyes as well. And we get those from fish, cold water fish that are oily, very rich in those fatty acids. Halibut, herring, mackerel, salmon, sardines, tuna, trout are all recommended. The Heart Association recommends at least 2 servings a week, a serving being 3.5 ounces cooked or 3/4 cup flaked fish, hopefully baked, broiled, or grilled instead of frying. Now, fats are another really important part of a healthy approach to eating. You know, we think of them as being the culprits, and instead, though, we want to think about, okay, let's choose healthy fats over the saturated or trans fats. Saturated fats like butter, lard, animal fats, gravies, cream sauces. Trans fats are liquid fats that have been processed in such a way to make them solid, like a margarine. So we want to limit those. And also, of course, fats are very concentrated in calories. So if we can watch the portion sizes, that's another really good thing to do. And then focus on the healthy fats that you see pictured here. Monounsaturated fats that we get from avocado, canola, and olive and peanut oils, for example. Polyunsaturated fats, which include those omega-3s that we already mentioned, but also omega-6s that we get from various seeds, eggs, peanut butter, and so forth would be some examples of some rich sources of these healthy fats. Now, another one that I know can really be challenging for people is eating whole grains. Number one, what do we mean by a whole grain? If you're reading the label, let's say you're trying to pick out a loaf of bread or pasta at the store, you want to check the ingredient list and see that the first ingredient is a whole grain. That's your most important thing. Why is that? Why does that matter? Well, it's because when we refine the grain, we lose a lot of the really important nutrients. And one of those really important nutrients that we need is selenium. It's an essential mineral, it's an antioxidant, and we get a lot of it when we have these whole grains. And so that's why we want to really be sure to include these. I find that a lot of times the reason I won't include whole grains is it takes longer to cook them. And so I finally figured out a strategy for me is to cook whole grains ahead of time and store in the fridge or freezer in convenient portion sizes that I can just pull out. And then when I need a quick lunch, I can make a nice grain bowl because I already have a cooked grain. And then another whole wheat choice I love are the whole wheat pita breads. Really great vehicles for not only adding your protein source, but also other vegetable sources. Now, whole grains do have a bit of a hierarchy. The more whole grain or intact they are, the better. And so you can see they move down. But let me emphasize, everything on this screen is a whole grain. It's recommended that at least half of our grain choices per day come from whole grains. So everything here counts. The ones at the top are even more nutritious and offer health benefits. So intact whole grain like barley and quinoa, the cut whole grain like steel cut oats or bulgur, rolled oats is next, shredded wheat, then the ground wheat flours, and then the ready to eat more processed cereals, but still containing whole grains there at the bottom. All right, now this is one that I think you probably have not thought as much about, and it's my favorite of all of the parts of the Mediterranean eating pattern, and that is being super generous and plentiful with herbs and spices. Well, why? Well, number one, they help add a lot of flavor, which can be helpful when you're eating less salt, but they also are nutrition powerhouses, absolute powerhouses. Now, do be careful about herb and spice blends that are mixed with salt. That we need to be moderate about. But the herbs and spices themselves are really nutritious. I love and have for years grown herbs and cooked with them. And I get so much joy from doing that. And I would just encourage, this is a great time of year to go to the greenhouse, the plant store, and pick up some herbs and begin to grow. I've got the list of the ones I love to grow and cook with there. I don't have much growing space. Used to have a big garden. I now have very limited space, and I'm still able to grow all those herbs and cook with them. And then the spices as well, many of which you see in those beautiful heart-shaped bowls there. So just want to encourage that. Start doing some exploration with that and just have a lot of fun. And then we'll end with these low-fat dairy foods, just moderate amounts of these. I love the plain low-fat Greek yogurt. It has so much extra protein and it's just versatile. So I'll just have it stand in for sour cream, mayonnaise, whipped toppings, and so forth, and then also use it for those colorful berry parfaits mixed with granola and so forth. So another great way to get some good nutrition and bring in extra fruit as well. Now, the plate method can be a great way to just learn about ways to appropriately portion your foods and have them in balance. And so if we think about your dinner plate, about half of it should be filled with as many colorful vegetables as you can, a quarter of it with your protein food, like for instance, that grilled salmon we looked at, and then another quarter with your grain or your carbohydrate rich foods, or your sweet potatoes would be an example of something that could fill in here. And to see how the foods are affecting your glucose level, you can check your glucose before and 1 to 2 hours after eating to see how your blood glucose responds to the food choices and the portions that you have. That's just a nice trick to sort of see how things are working. Now, we don't always eat on a plate. Sometimes we eat on a in a bowl. And the same healthy ratios apply here. A half colorful vegetables, a quarter protein, a quarter your whole grain. And here you just see some ideas of different vegetables you might use, protein sources and grains, and different flavorings at the bottom, one for a Thai grain and vegetable bowl. So have fun with this. This is one of my favorite lunches. And again, more possible if I cook the whole grains ahead of time. Makes it easy. I always want to make it easy to do the good thing and harder to do the less healthy thing if I can try to do that. All right, so I want to just end by sharing some of my favorite recipes with you. These are going to be available for you as a handout on the website. So you'll just be able to get a PDF and have a copy of all of these recipes along with a nutrition tip sheet. And I know you'll get the slides as well. One of my favorites are these Morning Glory muffins. These are the carrot muffins I mentioned. It has a whole wheat flour, grated carrots, yogurt. You can add different nuts and dried fruits to your own preferences, but really healthy. They freeze well and make a nice quick breakfast. I also love overnight oats because I can get that mixed up the night before, wake up, and I have a healthy breakfast with some fruit and nuts mixed in with the whole grain. The cranberry peanut butter granola bars are a bar I've been making for years, very nutritious, just full of healthy fruits and nut butters and nuts and whole grains, oats, and so forth. And you can design your own granola bar by varying the fruits that you use and the nut butters that you use. So it would be fun to have a Diabetes Sisters contest and see who can come up with the most creative version of this granola bar. And then just a few comfort foods, salmon and tuna turnovers, Texas caviar. Donna, you should love this Texas caviar. Some people call it cowboy caviar, but it's a mixture of colorful vegetables, canned beans, great side dish for the summer. So with that, I'm going to stop, and I just am excited to share these recipes with you. And then we can have some time for a couple questions, Donna, if you think we have a few minutes.
Yes, great. We do have time for questions. And thank you, Janice. That was amazing. And I think all of us out here are very hungry right now. It's lunchtime. Your pictures were so beautiful. So thank you. But we do have some questions that have come in. The first question is from Barbara, and it says, I find it challenging to get enough fiber. What are some ways to get more fiber in my diet?
Yeah, I think that's a very common challenge for so many people. And, you know, one of the best things to do is, I find for myself, is like I mentioned, cooking those whole grains ahead of time, like the quinoa, the barley, the brown rice, and so forth, because then that way it's ready to go in my refrigerator or my freezer, depending on how you want to store it. But it just makes it easy for me to go and grab the right thing. I love those grain bowls, but there's no way I'm going to fix them in the middle of a busy work day if the grain's not fixed ahead of time. It takes too long to cook. And then the other thing I like to do is use the whole grain flours, you know, the whole wheat flour, and make the muffins. And as much as we can begin to try to make some of our own things, I know that's not possible for everybody, and not everybody loves to cook like I do. I love to cook, but you know, that way you can incorporate some of the whole grains. There are fiber supplements that you can also use, but really want to encourage, first try to get it from your foods, and then you can also add in an extra fiber supplement. Remember to drink plenty of fluids as well as we increase our fiber. And then dried beans and peas, that cowboy caviar, really a great way to get tons of fiber.
Sounds yummy. I'll have to try it. Another question comes, I have good intentions for eating healthy, but it seems my best laid plans fall apart. What are some tips for keeping on track with healthy eating? And I'm sorry, this question comes from Suzanne.
Okay, great. So Suzanne, I think this is true for all of us. And I think sometimes we can we do well for a little bit, and then life happens and life gets in the way, and then we feel like we failed and we give up. And so that's where we have to really catch ourselves. Number one is recognizing what is keeping you from being able to eat healthy. What is it specifically that tripped you up? And then how can I remove that? So like we talked about with the whole grains, cooking those ahead of time can really help. Breaking down the individual steps and making it easier and possible. Do I have the vegetables and things on hand that I need in order to be able to put together a healthy meal? Stocking your kitchen and your fridge, your pantry and your fridge and freezer with healthy foods, like keeping the mixed vegetables on hand, are all things that you can do. And I would really recommend working with a registered dietitian, nutritionist who can help you think through some of these strategies, talk through your eating habits, your schedule, your routine, your day, and what then can suggest some of these practical things, including saying, let's design your pantry list, let's design your freezer list, let's design your fridge list, and work with you on putting together some strategies for helping to stay on track. But the biggest thing is, if you fail, we all fail and we all make mistakes. Don't use that as an excuse to just give up. Instead, pick yourself up, dust yourself off, recognize you and everybody else out there. It's going to fall and fail sometimes. It's okay. Just get back up and put the plans back in motion, figure out where the barriers and the problems are, and just keep on keeping on.
Very good. Okay, we have another question, Janice, from Jennifer, and it's non-fat dairy raises my blood sugar. Whole does not. So I tend to choose whole versions. How many servings of whole dairy are advisable per week?
Yeah, that I believe me, I totally get that. And I would not worry about it. I would go ahead and do that. And I would say, we aim for around 2 servings of dairy per day. So 2 per day, and you're just using the full fat. Now that means you're getting some extra calories from that. So you may need to trim on calories somewhere else. But I think that's perfectly fine. And if that works better, and that's exactly where, checking your glucose before and after meals so you can kind of test and see these things out. When people tell me they have those kinds of experiences, I'm like, let's go with what you're finding out for you. We are all different. And, these hard and fast rules that have to apply to everybody don't necessarily apply to everybody. And so I would just go with your full fat dairy and keep it to the 2 servings per day or thereabouts, and you'll be fine.
Good. And we have one last question, and it's a loaded question. And it's from Joan, and it says, it seems there is a lot of conflicting and confusing information about healthy eating for diabetes. Why is this?
Yeah, there absolutely is a lot of confusing and conflicting information about healthy eating for diabetes. And part of that is because there's so much interest in nutrition and eating and so forth. And so what you'll see is a lot of media attention to it, and sort of over reporting some of the results and kind of contributing to the confusion. One of the things to really watch for with nutrition research is a lot of times you'll hear a sort of a dramatic headline reported, but when you look at the actual study, you'll find, oh, it's a correlational study. It's not something that's been randomized. And so therefore we can't really see the cause and effect. Oftentimes things are presented as definitive end all results that are not. So nutrition is a science. We're continually learning. Things change as we go. But more and more and more, we're really learning that it's important to focus on healthy eating patterns, not specific nutrient by nutrient emphasis, like I must eat high carb or low fat or whatever. It's more choosing a healthy eating pattern with those 3 principles involved versus focusing on a specific diet per se. So I hope that helps.
Very good. Thanks. Well, we're about out of time, and I just want to say a big thank you to Janice. This talk was amazing. I do want to also thank our sponsor, Regeneron, for giving us the opportunity to share this information with our members. So be sure to check out our eye articles that Janice has wrote. They're available on our website, and it's a lot of valuable information about all aspects of eye health. Next week on Thursday, the 20th at noon, we'll be hosting a lifestyle series entitled Mastering Meal Planning, Expert Tips for Healthy Eating with Diabetes with Constance Brown Briggs, which will be really good and kind of a continuation of the discussion that we're having here, because you really can't get enough information on nutrition. It's like one of the #1 requests all the time, because like you said, it is complicated and there's so much information out there, and a lot of it can be conflicting at times. So today's program was recorded and will be made available as a download on our website in the upcoming days, and will be emailed out to all the registrants. So thank you. And again, thanks to our sponsor, Regeneron, and thank you, Janice, so much for a wonderful webinar today. And on behalf of Diabetes Sisters, we thank all of our guests here on the call today, and we hope to see you in the future. So have a great afternoon, everybody. Thank you. Bye-bye.
Bye-bye.